I don't know what's going on here. I got hot flashes. I want a divorce. I have rage. There's my libido. What libido? From birth to death, you have hormones, okay?
I'm Dr. Tara Harding, and I'm an expert in women's healthcare.
TikTok blew up. We don't talk about periods and emotions and feelings. We don't talk about that stuff. We have to start talking about that stuff.
I saw this need for truly a healthcare provider who listened, who allowed for time, and who simply believed the patient and what they were going through.
Women are diagnosed with cancer 4 years later than men because we're not believed. We walk into a provider's office, we say we don't feel good, we're told it's normal. Part of medical gaslighting is when you are asking questions and you are met with resistance. Nope, all your tests look normal here, but you don't feel good. That's a red flag. Not normal to have pain and issues, okay? Not.
Anyone who's been told over and over again, oh, that's just part of aging, or that's just how this is, or there's nothing we can do for that, it truly turns into a mental health concern. It's heartbreaking.
This is the reality of healthcare in America that women are facing. Let's start a family. Like, hit a button, that's how this is gonna work. That's not what happened though. As a healthcare provider, I became a patient.
I was told I had the diagnosis of unexplained infertility.
And to me, that was devastating, frustrating, and confusing all at the same time. There's no answers a year into this, and no one can give me an answer to my medical diagnoses. My health fell apart, my marriage fell apart.
From no insurance coverage to a traumatic pregnancy. There were so many pieces that I saw as a healthcare provider going through that I really felt needed to be changed. I simply called my District 28 representative. I want to bring a bill forward. Infertility, according to the World Health Organization, is a disease. And I'm not okay with insurance not covering a disease. For the first time ever at the national level in June, a bill was heard. Every year we are making huge steps. There's more yays and green votes coming through, and there's awareness being made.
It makes me so proud.
So proud, so proud. Yes, yes.
I will not stop fighting until that's passed.
You could just feel her passion for what she was talking about, and it got me all fired up, and I'm like, yeah, I'm gonna go march on Capitol Hill.
Your voice matters. Recognize that. Recognize the power that you have to drive that change in healthcare.
I decided that I was going to start my own healthcare practice.
Her message tonight was all about creating a safe space for women to feel heard and to trust their body.
If you don't feel well, you're not well. It's real.
You learn a lot from her, and you realize that, like, I'm not crazy.
Trust those symptoms. Trust that there's answers out there by some healthcare provider who is right for you.
We deserve to be on this earth and enjoy our time. Don't give up.
She's an absolute advocate.
And we believe you.
You deserve to be healthy. You deserve to feel good.
If you don't feel well, get to someone who can look into this further. I want you to book the vacation, book the dancing lessons, book the flight school, book that healthcare appointment. That might be like your wild thing that you do. Vacations or vaginal exams. I don't know. That's like, woo! Do both, okay, do both.
It is your right as a patient to have answers.